Well done on having your tooth out. Aftercare. First job, take it nice and easy for the rest of the day. Whoever your significant other is, partner, mother, I want you to have your feet up and I want them to look after you for the rest of the day. EastEnders, Coronation Street, watch them all. Next job, cold food and soft food. I want you on mashed potato, cottage pie, anything without little bits in, so no apple crumble, things like that. Okay, anything you can mash up which is cool, that's grand. Why? Number one, we don't want things going into the socket. And number two, if you have warm food, it can bleed as well. Next job, by the time they get home, take a couple of paracetamol. That kicks in by the time the anaesthetic wears off. A little bit of pain and swelling is good, but if it's adverse or abnormal pain and swelling, you need to get in touch with us. Be really careful not to bite your lip, your cheek, your tongue, because when the anaesthetic wears off, it'll be really, really sore. Pain varies from patient to patient. Chances are, if you had to have a tooth removed, you will be pain-free afterwards, because you will have had it removed because it was painful. But paracetamol, ibuprofen, take that and keep yourself topped up on it. Next job, no spitting or rinsing. So for the rest of the day, we don't want you to spit out or rinse your mouth out, because you can develop the dry socket. So because of how a tooth socket is, imagine the tooth is like this, you take the tooth out and you have a defect. Blood comes into the socket and it heals up from the bottom upwards. If you lose your blood clot, you've got a lot of exposed bone and that can become infected. How will you know you have an infection? Bad taste, bad smell, pus, and a lot of pain. Come and see us straight away if that happens, because number one, we can easily fix it. And number two, if you don't, you can develop something called sepsis, which is a life-threatening condition. Saltwater mouthwashes, everybody loves these, but don't do them on the same day as your extraction. I like them from the day after, and I tell my patients twice a day for 2 days. Paracetamol, as we said, take that by the time you get home, and then get some really, really good sleep. So me, after I've had an anaesthetic, I like to go to sleep. I like to go to sleep anyway, anytime. But yeah, go to sleep. And then yeah, you should be fine. Keep out for the signs of dry socket, as we said, and any other problems or concerns, get back in touch with us.